Hi everyone, thanks for listening to all my presentations. I have published a separate presentation on hepatitis C virus symptoms, historical path to progression and chronicity, the fibrosis of the liver and liver failure. I've also published another one on who should be screened and how to make a definitive diagnosis of hepatitis C virus. Today, I'll be going through preventive measures because prevention is cheaper than cure. And before I'll be able to reach that, we should know about risk factors. When we know about risk factors, then we'll be able to find our way into the preventive measures. And to those who would not bother themselves about preventive measures, I will let you know the complications of hepatitis C virus if by accident you should acquire it. And of course, the prognosis. So, hepatitis C virus prevention, risk factors, complications, and prognosis. Okay, risk factors or causes are blood transfusion before 1992, contaminated blood, IV drug use, occupational hazard like healthcare providers, like rescue workers, emergency service workers, blood transfusion unit department workers, nurses, doctors, no, everyone in health field. Illicit drug use, HIV infection, still on risk factors, piercing or tattooing, organ transplantation before 1992. So if you have any family member who is probably old right now, who had received organ transplantation before 1992, the individual is having the risk of possible hepatitis C virus and should be screened. Clotting factor concentrated before 1992, hemodialysis for a long period of time, children delivered by hepatitis C mother, inmates in prisons, anyone born between 1945 and 1965. Now, prevention. I will do more on this because that is why I'm making this very presentation. Don't donate. Don't donate what? Don't donate blood. Don't donate organs for transplantation. Don't help that family that will need your semen for in vitro fertilization. Don't donate. Okay. Inform. Inform who? Inform all sexual contacts that you have hepatitis C. Defer to them. Don't kill them with hepatitis C virus. Use what? Use condom. Once you are hepatitis C virus positive, known, use condom. Disclose your status to your doctor. Disclose your status to your partner that you have hepatitis C virus. Help them. Stop alcohol. Alcohol and hepatitis C virus at the same time on your liver would not be helpful. Stop indiscriminate drug use. Almost all drugs we take per oral will go through the liver for first pass effect metabolism. When you load your system with too many medications and you have hepatitis C virus, liver enzymes is showing that there's liver injury. You are not helping that liver, you are not helping yourself. Stop IV drug use because that is almost the commonest route to acquire hepatitis C virus easily. Don't exchange needle, with anyone because you need to ingest that street drug. Stop it. It will make you live longer. Piercing should be done in a clean environment. Okay, you're going to pay for it, right? Even if it is all free, first thing first, make sure the person helping you with the piercing is going to use either a sterilized or a brand new equipment. Tattoo should be done the same way. Clean, brand new or sterilized equipment. Safe sex, like I've said, use condom. Cover your wounds. Don't let someone else get the virus from you. Help those loved ones around you. Thorough blood screening before transfusion, that is going to be the job of those of us in health field. The mistake could be made in certain centers, but should not be made by you. No, we should all be informed by now. Blood product screening before transfusion. So anything we're going to transfuse, either platelets, concentrate, whole blood, packed cell, should all be properly screened for, all things we're going to screen for, right? HIV, hepatitis B, hepatitis C, and so on. And I will add, don't exchange your combs, your razors with anyone once you know you have been diagnosed. And if you are not even diagnosed, spend your money buying your own combs, your razor. Don't stop sharing it, toothbrush, stop sharing it with people, please. Vaccination against hepatitis A and hepatitis B virus will help. But there is no hepatitis C virus vaccines. And someone would then ask me, then what is the importance of vaccinations? Okay, let me give you the answer. I've said there's no vaccine for hepatitis C, right? There is that probability of co-infection with hepatitis A or hepatitis B or HIV that will be horrible. So if you can't get vaccines for hepatitis C and the patient, unfortunately should acquire hepatitis C virus, but because he or she has been vaccinated against hepatitis A and B, then co-infection with hepatitis A and B will likely be out of the way. Isn't that better to have hepatitis C virus alone than having co-infection with hepatitis A or B? That will make the situation worse. I think the latter will be preferred. Okay, to those who would not like to embark on preventive measures, I don't have to scare you, but just know what may happen if by mistake, by accident, you fail to prevent what is preventable and you come down with hepatitis C virus. Complications. Fibrosis will eventually occur in the liver after a long time. Then there will be cirrhosis. Then there will be hepatocellular carcinoma, and the liver will shut down, giving us liver failure. All this will lead to problems that will affect the brain. We'll have hepatic encephalopathy. The prognosis. Okay, I don't want preventive measures. I don't really care. If I have it, I have it. Oh, okay, wait. Here is what may likely be the outcome. The lifespan would decrease with the chronic hepatitis C virus. The overall survival would decrease when there is liver cirrhosis. And remember, liver cirrhosis is part of the complications. There may be death at a younger age in younger people with hepatitis C virus. There's likelihood of increased mortality as the disease progresses to liver cirrhosis, hepatocellular carcinoma, liver failure, hepatic encephalopathy. There will be higher mortality with liver cirrhosis. You don't want that, right? I don't want it, and I don't want it for you. So let all of us embark on preventive measures against hepatitis C virus. I don't want this campaign to end with me. Let it begin with me and take it up and spread it to everybody. With that, I come to the end of this very presentation. Please remember to share this with your loved ones, with all your friends on your platform. And remember to subscribe. I appreciate it. Thank you.